Hello dear subscribers. In this program, we will talk about the thyroid gland, as it plays an important role in the human body. This gland is located on the front surface of the neck and produces hormones that regulate the body's metabolism, growth and development, as well as the functioning of many organs and systems. Symptoms of thyroid problems can vary depending on what exactly is going on with the gland. However, some common symptoms may include fatigue and weakness, which may be related to low thyroid hormone levels, hot flashes and sweating, which conversely may be related to high thyroid hormone levels, weight problems, such as weight gain or loss for no apparent reason, digestive problems, such as constipation or diarrhea, frequent heart palpitations, arrhythmias, or chest pains, mood problems such as depression, anxiety, irritability, or sleep disturbances, swelling around the eyes or on the face, hair loss or brittle and weak nails, decreased body temperature. Thyroid disease is quite common and is more common in women than in men. Records show that about 12% of women and 1% of men suffer from some kind of thyroid disease. Among women, thyroid disease can occur at different times of life, such as during pregnancy or menopause. One of the most common thyroid diseases is diffuse toxic goiter, which occurs 10 times more often in women than in men. In men, thyroid disease usually appears later than in women, and is most often associated with various forms of thyroid cancer. It is important to take care of thyroid health to avoid possible problems. You can do this by following a few simple guidelines. Check your thyroid hormone levels regularly, especially if you are at risk for developing thyroid disease. For example, if there is a history of this disease in your family, blood tests to determine thyroid hormone levels are recommended. Avoid stress, which can negatively affect the thyroid gland. Various techniques can be used to manage stress, such as yoga, meditation, deep breathing. Lead a healthy lifestyle that includes proper nutrition, moderate physical activity, and adequate rest. Consume enough iodine, which is an important element needed for proper thyroid function. Blood tests must be taken for comprehensive tests. There is also a well-known home test method. Dip a cotton swab in iodine and draw 3 different size strips on your forearm. The first should be about 4 mm wide, the second about 7 mm, and the third about 1 cm. And in the morning, after waking up, look at what has become of the stripes on your skin. If all the lines have disappeared from your hand, you have a severe iodine deficiency. The recommended amount of iodine intake may vary slightly, depending on a person's age and gender, but in general, it is recommended that adults consume about 150 micrograms of iodine per day. For pregnant and lactating women, recommendations for iodine intake are higher and around 220 to 250 micrograms per day. For children, the amount of iodine intake also depends on age. For example, for children aged 1 to 8 years, an intake of 90 micrograms per day is recommended, while for children aged 9 to 13 years, an intake of 120 to 150 micrograms per day is recommended. What foods contain iodine? Of course, iodine is found in seafood such as fish, shrimp, and seaweed. There is more than a daily dose of iodine in 100 grams of these foods. But if you live in a country where seafood is scarce, or has it, but the prices are way expensive, you can get enough iodine from other sources. Here are a few foods rich in iodine that you can add to your diet. Cranberries, a small sour berry, contain a huge amount of antioxidants, valuable vitamins, elements and substances, including vitamin C, vitamin K, which promotes better absorption of calcium, fiber and iodine. 100 gram of cranberry contains about 350 microgram of iodine. Add cranberries to salads and sauces and the daily norm of iodine will be provided. Feijoa. A distinctive feature of feijoa is its iodine content. Nutritionists compare this fruit to seafood in this parameter. None of the known cultivated plants accumulates so many organic compounds of iodine as Thyroid. The amount of iodine can vary, depending on the region of cultivation. The closer to the sea, and the more of this trace element in the soil, the more iodine in the berries. On average, in 100 gram of Thyroid, more than 50% of the daily norm of iodine intake. Persimmon is a very interesting fruit, which has iodine necessary for residents of those countries where there is no sea. Persimmon contains 30 micrograms of iodine per 100 grams of product. Very few other foodstuffs can compete in this respect. White beans, dish made of beans, are not only tasty and rich in iodine, but also very useful. Beans are full of fiber, the benefits of which we are already well aware. Beans have a low glycemic index, which is extremely important for diabetics. White beans are rich in magnesium, copper, zinc, folic acid, which is necessary for creating new cells in the body and maintaining their normal state. 100 grams of beans contains 30 micrograms of it. Eggs. One egg is 50 grams. One egg contains 20 to 25 micrograms of iodine. Iodine in eggs can vary depending on the bird's diet and the region of production. You can sometimes find iodized eggs on the shelves of supermarkets. Strawberries. This sweet red berry has a fair amount of iodine. One cup has almost 10% of the daily intake, about 13 micrograms. In addition, strawberries boost the immune system with vitamin C, regulate blood pressure, and, according to research, lower bad cholesterol. Prunes. Just for the huge list of important properties, it is definitely worth adding to your diet. Prunes prevent the occurrence of serious diseases, such as cancer, regulates blood sugar levels, which can save from the type 2 diabetes, reduces cholesterol and strengthens bones. Prunes also contain vitamin K, as well as beta-carotene, and just 5 prunes contain 13 microgram of iodine. Dairy products, especially such as cottage cheese and yogurt, where the amount of iodine per 100 grams is about 10 to 15 micrograms, and of course iodized salt, which can be used in cooking. Remember that the amount of iodine in foods can vary depending on where they are grown and how they are prepared. It is important to monitor your diet and, if there is a need for additional iodine intake, consult a doctor or dietitian in order for the body to properly absorb iodine. It also needs to get enough of certain micronutrients, including selenium, iron, zinc, copper and vitamin C. For example, selenium is an important micronutrient that helps turn the inactive form of iodine into the active form. Without selenium, the body cannot use iodine properly, even if sufficient iodine is present in the food. That is, it is important to watch the balance of other micronutrients and vitamins in the body, because they can also affect iodine absorption. A balanced diet is what we need. Taking care of your thyroid is an important part of your overall health. So follow the recommendations above and have regular checkups. Thyroid function recovery depends on many factors, including the cause of the dysfunction, the degree of damage, age, and the person's general state of health. For example, if the cause of thyroid dysfunction is iodine deficiency, with proper iodine intake, the recovery process can occur fairly quickly, within a few weeks or months. For more information or advice, you can contact us on the WhatsApp number you see on your screens. Subscribe to our YouTube page and share your comments. Specify your questions and topics of interest in the comments. You can subscribe to our Telegram, Instagram and Facebook pages. Links can be found in the description below this video. Thanks for watching. Stay healthy.